You want to be afloat? You want to float? Float on, float, float on. Remember that song? Let's do it. Terrace, and my name is Patrice. Now I like subscriber that's like and subscribe. Hey, float on. Just hit the notification button. Make sure it says all. Float, so you can always get my notification when I post. Float on. So if you're one of those, just float on. Just a little fun. I'm just feeling a little silly. Welcome back to my channel. I hope you're having a good day. I want to talk about float nursing, being a float nurse. When we think of float nurses in a hospital, we think of nurses that float to every unit. But what I'm talking about is a little different. It's a float nursing position in corrections. And I'll explain what's the difference. The difference between in a hospital setting as a float nurse, like I said before, you go from unit, you go to mother baby, you go to ICU, and you working as a nurse. So I would imagine, because I've never did it in the hospital, I would imagine that it's more experienced nurses. They have many years working in every unit that they feel that they can handle it. I would not recommend that particular scenario for a new nurse. PRN position is another position they might use. PRN position means that your schedule based on needs. Some places, like in Georgia, they want you to schedule, but actually PRN is whenever you need the staff, you call them if they're available. But some facility wants you to give them upfront like a full-time schedule, but you only hear it from me. Now, a position as a float nurse in a correctional setting, that's what we're going to talk about today. I think new grads can work it, but they have to have confidence in their skill. But all it takes is, this is not like you're going to be floating to inside one particular prison, inside one particular jail. No, you're going to drive your car to work for this particular detention center, and then maybe 3 more days your schedule will be into another correctional facility, and so forth and so forth. So this is what you going to encounter. And my thing is, I like the way Philadelphia system set up. I love their med room. I could be in there all day with my radio, getting my meds together by myself or with another nurse, and we just be kicking it, helping each other, doing the med pass. I love it. Now, I've done the setup in Georgia. Their med room is not like that. When I went to Illinois, I have to go out and give the meds to each pot. I hated that. So it depends on how the setup is, how the med pass room, I should say. Anyway, in Clayton County, I think they set it up a little similar to, they have a med pass room, and they just come and you give there. So, like I said, the environment may be different, but you know you're there. And another thing about being a flow pool nurse, they usually offer you a little higher rate because you're going to have to do a lot of things that maybe their staff is not available to do, and you might be in a position to have the skills that they may not have at the time. The cons. Here are the cons. Like I said, lack of control of your assignment. They said they may schedule you at this particular assigned facility, and you may not even like it, but you have to do it for like 3 weeks. They want to hold you on for 3 weeks, and then you go to another one. That's why I like going from facility to facility, because I don't want to be pinned down in that facility. Okay, I took a schedule for 3 weeks. Can't wait till I can go to the other one, and then I could come back and breathe. So that's one of the cons, lack of control of your assignment. That means you don't have any choice. And sometimes it could be a bad assignment. That's one of the cons. Every day is a new protocol when you come in. Because listen, you're going from facility to facility. Every day they change stuff. And so you have to keep up with that. So when you get there, to keep yourself safe, is there anything I should know? Any new stuff? You know, they usually have a book of updates when they have like their staff meeting. They put it in a book, so you can actually, if you don't hear from other nurses, because it may not be a regular nurse that's there, you could go in the book and they may have changes. Don't give such and such inmates, make sure you see him swallow. So that's why you have to read the book. He is cheeking his med, and when I say cheeking, he's putting it on his tongue so he could go and sell it. I'm saying that, you know what they do with it. So make sure you see him swallow. Even though one of the things, when they say that, you actually can look, make sure he swallowed in front of you, but you don't know, because the officers, I'm used to the officers, the one that is right out there with them. The officers giving them water and they're swallowing it. But anyway, they put that all in the book. Make sure you watch and make sure you don't put next to the med pass door, the window, make sure you never put your insulin syringe close by. I know you want it to be in arm's reach so you could have it and you already pull it up for the inmates coming and you want to give their meds. But a situation can happen, and it did happen. The inmates put his hand, and they're so fast, and take out the needle that you may just, it can distract you. You're trying to give another person medication, and when you're not, in a blink of the eyes, they take it. The insulin needles, they count them. We have to count them. So if it's off, you're responsible, and that's a med error that you don't want to make, and you're in correctional. Remember that, because you're not far from going downstairs and being locked up. And I'm being serious. So make sure you don't put it near you. Make sure you step away. Everything, medication, narcotics, is not close to the open area. I call it the window, because they can stretch their arms. Believe me, it happens. So that's another new protocol. Every day is just, so you really have to be on top of your skill. And you always have to think safety, your license, because when you go into the facility to facility and you don't know the protocol, you don't know the real rules, you want to get your medication, you're in a hurry, you forgot to look in the book, they say, don't give Mr. John his medicine today because he's going to surgery. You didn't, and you gave it. That does cause a lot of confusion, and they'll probably get mad and don't want you back. So always follow protocol. The turnover rate in correction is very high. And I think one of the things why it's so high, because you're there every day. 12-hour shifts, you might not be there. You're there maybe 3 days. But when it's 8 hours, I don't like 8 hours anymore. I don't want to be there 5 days every other weekend. There's a lot of overtime in corrections. But you get burned out real quick. So just be mindful. Would I recommend this for a new nurse? Yeah, I think a new nurse can do it. I mean, just float. If you want, you might ask them, can I just do meds? And that way you get, in tune. Now, the bigger facilities, and I'm going to always how you feel or how your anger towards certain things that may happen. It might cloud your judgment, how you treat them. Be mindful of that. I can't get around not listening to the news, and sometimes when the inmate comes in, nurses like to point them out to you, but I don't want to hear about what they did, because if it's something bad, I'm afraid that I might treat them a little different, and it happens. It happens. So be mindful. You don't have to sit there. One nurse, she will sit there. Did you know he did this, did that? Read the chart. I don't want to know about that. My job, and I'm going to tell you this, new nurse. When you walk in that door, you walk in with confidence. You walk in that you're going to do a good job. Even if it's a person that you know that if you come in contact with them, you know what they did. Try to just focus. This is a patient. Treat them like a patient. Another con is shift. You may start out, everybody's nice when the first few weeks, they give you the shift you want. Oh, you like all the day shift you want. You're going home, you're rested. Then all of a sudden, they don't have anybody at night shift, and you could be flipped. So be mindful of that. You're in a contract. Yes. So you can't get out of that. I want to go back to that book. And I want you to think you're still in correction. So always remember that. When you get to that door, you can't have your cell phone. You can't, the officers are really in charge. And listen to their rules. One of the things that you never divulge, never, ever, ever divulge. Some of the inmates, they're going to be released. They're going to another facility. Maybe they're going move into the Rikers or whatever. I'm just using those name of the correctional facility. You never, ever, ever divulge that information to an inmate that he's going to be released tomorrow. When you talk him to medication, never. Oh, Mr. John, I don't have your medication. But I see that you don't really need it because you're going to leave tomorrow. So you just got to be careful, or they may ask you. So that book come in hand. The officer won't tell you because these are rules that the director of nursing automatically think you got that information in orientation. So those are a little tip that you could just do it. I don't know. It may say now I'm leaving. I don't know. It may want to tell you you're in there doing a treatment. I want to tell you where I hide the money. I don't want to hear anything. I never want to hear anything because you become a liability. You get pulled into court. They like to pull you. Another thing is inmates like to sue. They're very knowledgeable and they love to sue. And you may be a part of that. I tell you this, I tell you that. I don't want to hear anything. Please, just let me do my work and move. That's the kind of attitude I have. Not being mean, but be firm. Another thing is you always have to, when it comes to medications, at night shift, if you happen to work night shift, you will be the nurse that is responsible for giving the medication to the inmates that are moving to another facility or going to court. So you will be the nurse. And I'm gonna give you a little this little tip that I learned from working in the prison system, that I noticed that when the inmate is going to court and he knows that he's going to be sentenced, he's a risk. He's the risk, and you always want to take care of patients that are alive. I had a inmate. He came back from his sentencing and jumped over the balcony. So they act tough, but when it's time, when you're faced with what you're going to be here for the long term or what's the outcome, it becomes real to them during sentence time, and they can go off the wall. So those are the things that you need to be mindful of, those inmates. What you do before you touch any medication. And sometimes the nurse may not be around. She shouldn't leave you without counting the narcotics. And I noticed that the book may be scattered, but you haven't been there. You are a float nurse, so you need to make sure your narcotic count is correct. And it's longer in the prison system because you have to count the needles. You have blister pack. Yeah, that's the word, blister pack. You have to count the narcotics, and it's so much things you have to count before they hand over the keys. And do not take that key home. Do not take that key out the building. If for some reason, and we all make mistakes, you have to bring it back, because they're going to send the police to get you to bring it back. So just bring it back. Save yourself the embarrassment. So make sure your narcotic count. Make sure before the nurse leave, come, let's count. I haven't been here. I just got here. I haven't been in this facility. I need to count everything. If there's another nurse and she says she count, then she's responsible, because she said she already count. And you both work in the same shifts. And just make sure with narcotic, especially in the prison system, I find that when you give, because there's a lot of inmates you're giving medication to. So what I like to do, and sometimes it can make the process slow and they get upset, but I just kind of ignore them, block them out. Once I give it, I just write it and sign it off in the narcotic book. Because if you don't, I can't remember that I gave Tim 2 pills. And I'm telling you why I can't, because a lot of Tim's there, and I gave codeine to this one, I gave codeine to that one. So just write it down the same time. Or if you don't, for some reason you forgot to do that, and when you're doing your end of your sheet, just have a little piece of paper. You could do it this way too. Another way I do it, I write it down, inmate name, inmate number, and then I write 2 Tylenol with codeine given and the time you gave it. If it was a PRN, that means he doesn't have it scheduled, you write that next to it. So when you go back, because you might not have time, I'm be honest with you, the medication book is thick. And you don't have time to go. I didn't have time in Philadelphia to go find the inmate names and write and sign it off. So what we usually do, since I was working there full time, I kind of know the inmate, because one of my other jobs after we give medication, That's why the medication room was the perfect quiet place, because I have to take off all these orders. So when the other nurse we work, you take from A to F, and I do the rest, and we take off orders so that when night shift comes or when 9 o'clock meds come, we have the patient's meds, because they're going to come out. The doctor wrote this order and you didn't do your job, blah, blah, blah. So if after we finish giving out medication, then we might go back. It's easier for me to go back and sign off that I give it, and then you have to make sure this person didn't come out for meds. And if it's what I like to do, I don't think all the nurses do it. If it's like an important medication, I may ask the officer, please call this person. He got to have it. Like back in the days, they had the AIDS medication and it was in the fridge. And maybe the nurse didn't know that and they have to have it. They require him have, the doctor wanted him to have it every day. So I did my medication, and during when I was going around and signing off my book, I noticed that David didn't come out to get his meds. And so I had to ask the officer, can you please call him out, and so he could come get his meds. If he refused, then I would write refuse. You document everything, because they look at that. Something they look in the book. You never know when they will look in the medication book. Did he get his meds? Why he didn't get his psych meds? You know, stuff like that. Just little FYI to keep yourself safe, because you're not permanent staff. You're floating, and they like to, just like travel agency, you might get caught up in something that you didn't even have. Anything is out of your control, and it's your license. So the big thing is the narcotic. The narcotic can be, I don't even want to talk about it. It's just, medication was just all over, and you have to sort it out. That's what I didn't like. When I went to California, it was like this big tables, and it's like 10 nurses at the table, and all we did all night long, night shift, and you know night shift and me don't agree. All we do all night long is to take orders that was piled up for days. So I don't like that. So just have to have some organizational skills, or do it, make it easier for yourself. Write it down, or you can be slow. You say, I'm signing out my meds as I go. That's the correct way. The moment you give the meds, the moment you sign out. But you can get pressure from the officer, because they don't want to stand up in the line so long for you to give the medication. So just write it down. The preferred way for new nurses is to sign it off as you go, because you'll see. Don't get hung up that it's only going to be the LPN giving meds, only the LPN giving, doing the finger stick. No, the RN, well, at least that's what I know in Georgia, they have LPNs doing the medication, but in Philadelphia, it was equally LPN and RN doing the same work. Most of the time, working in the clinic, you're working with the doctors. That's the RN job. Assessing the patient, professional at all times. Don't be mean. Don't be cursing. Don't treat people any. Be professional, everyone you meet. It's okay to say good morning to someone when they say good morning to you. Be safe. Keep your license. I want to see you back here. And you want to keep it for the long term.